For months, we've heard how staff shortages in hospitals are impacting Manitoba's healthcare system. Tonight, a Winnipeg man shares his family's story. He says a lack of home care has left him caring for his dying common-law partner all on his own. The CBC's Alana Cole reports.
For Eric Schepper and his partner Kathy, it's all happened so fast. He says Kathy was diagnosed with stage 4 pancreatic cancer in November. In December, she collapsed and spent weeks in hospital. Then in January, after careful thought, he says she chose to receive palliative care at home.
If she sees the end of this month, it'll be a lot. It'll be a miracle.
Schepper says he was under the impression there would be help available, a nurse coming once or twice a week to check on her, home care, and respite for him.
Well, my expectation was, of course, that would happen. Unfortunately, those expectations haven't been met.
You see, while she has had visits from a nurse, there's been no respite. And he says despite repeated requests, no home care to help with things like bathing. He says a sponge bath is the most he's been able to do on his own.
It's going from anger to outrage to sadness to disbelief there's a whole bunch of emotions there. To me, it feels like the system that we are paying into as taxpayers, it's failing us. It's not providing us with what we need.
In a statement, the Winnipeg Regional Health Authority says its home care program is short-staffed. A spokesperson says they recognize the needs of palliative care clients and are prioritizing filling services as soon as possible. Schepper says this week he contacted a foundation that supports cancer patients, and within a day, they were able to hire home care to help Kathy for a couple of hours.
When I came back, Katherine was laying there with a smile on her face. I hadn't seen a smile since she came home. So that tells me that these people, these home care workers, they are really needed.
He says he's speaking out in hopes of helping other families.
That this is a disgrace. That's all I can say about it. And I'm looking for accountability. I want to know how come.
For now, he's on leave from work to care for Kathy, and he's looking to other options for help. Alana Cole, CBC News, Winnipeg.
Now, in response to CBC's coverage of that story, Health Minister Audrey Gordon called the situation sad. She says there is a plan for seniors and long-term care coming. The president of the Winnipeg Regional Health Authority says more home care attendants are being trained right now.
We are training 300 additional care aides to work in the community environment. That work has been initiated. We've got a group that's training them. So we are paying for people to receive their training, and then we're going to be launching those individuals out into the community to address some of the challenges that we've been experiencing in home care.
Mike Nader says those new workers could be deployed as early as this spring.